So then when we talk about the ACL, the number one best test to assess your ACL, number one best test is the Lockman's test. Some people call it the Lachman's drawer test. When we do this, again, remember we just said 20 to 30 degrees is ideal for the varus valgus test. It's the same for the Lockman's test. And people have different ways of doing it. If anybody ever wants to know what mini hands look like, these are itty bitty hands. Playing piano for years and years, it was a struggle bus because I struggled to hit the octave. So when you do stuff, some people can just hold their leg like this and get a really good shift, and actually it's working on Charlie. Good job, you're super relaxed. But mostly for people, what I have to do is I have to put my knee up underneath their thigh, so that way, in the very distal part, so that way it's supported, and that also helps them relax their quad and their hamstrings and their hip flexors. And then you hold it, you're gonna stabilize, you're gonna wrap your hand underneath behind the tibia, and then it's a straight anterior translation. So we're trying to go like kind of straight up an angle like this. And again, we're just pulling straight up, and he has never hurt this. And if he did, the surgery was excellent, and also there's no scars. So good job that you don't have any of that. All right, so that is the Lockman's test. That is the best, most sensitive and specific test for the ACL. There's other tests that we can do. So one of them is called the anterior drawer test. So again, same idea, you're pulling forward, but now we should be at a 90-degree angle, and you sit on their foot and you wrap your fingers, your index fingers, across or behind, kind of posterior to their proximal tibia, and you just tell them to relax. You put your fingers kind of in the joint line, and you're gonna lean back and just pull real gentle on it. And again, if it's positive, it's gonna shift forward. It's gonna have that anterior translation. So remember what I said in the foot and ankle, whatever they did to hurt it, that's how you're going to test it. And remember I said that if you're gonna have an injury to the ACL, it's gonna be anterior translation of the tibia. So for us to see if it's torn, we have to translate the tibia anteriorly. It's not shifting, he's not complaining of pain, his ACL is fine. Then we can flip it around and do a posterior drawer. So what do you think that's testing? I'm gonna push posterior, PCL, right? Because we're gonna do posterior translation, so I don't even have to move, and I can just push posterior on it. And if it sagged back, if it pushed, if it had any kind of crazy stuff, then what we would see is a positive posterior drawer test assessing the PCL as we do this. You can also do these tests with a little bit of internal rotation or external rotation to assess the different corners of the knee. For the purposes of this class, I especially just need you to know how to do it straight, but it is a good idea, especially if you're going to be a clinician, to understand that there's other variations of it, and that you should be assessing, especially the posterior corners, because those are frequently injured with knee injuries. Then we also have the Posterior Sag Test, and this assesses the PCL. It's also known as the Godfrey's test. This is about the easiest test ever to do. And all you're gonna do, and you should do both legs at a time, is you're gonna have them start just kind of with knees bent, and then there's a couple different ways to do it, but what you do is you take them and you tell them to stay real relaxed, and then you bring them up in the air, and then you just look and see where their tibial tuberosities are. Again, he hasn't ever had a PCL injury, so there's not a whole lot to see here. But if somebody had torn their PCL and they were able to stay really relaxed, the side that was torn, their tibial tuberosity would sag down, so it wouldn't be level, and their patellar tendon would be stretched down a little bit. And so again, that's a really easy test to do to look for PCL tears. And it's a pretty sensitive test, I guess. You can do that one.